Let's talk about tuberculosis. Tuberculosis is a bacterial infection caused by Mycobacterium tuberculosis and Mycobacterium bovis, Mycobacterium africanum, Mycobacterium microti also can cause tuberculosis. It is spreading through respiratory droplets released to the air by coughing, sneezing, shouting, etc. What are the risk factors for tuberculosis? Immune deficiency like HIV infection, immunosuppressant therapy, chemotherapy, diabetes mellitus, chronic kidney disease, vitamin D insufficiency and malnutrition, and also poor social condition, overcrowding and alcohol intake. Those are the risk factors for tuberculosis. Then let's talk about the types. There are two main types of tuberculosis. First one is MDR-TB. It's multi-drug resistant tuberculosis, and here the bacteria is resistant to rifampicin and isoniazid. And the second type is XDR-TB. It's extensively drug resistant TB. This type is resistant to previous drugs and even for quinolines and second line agents like injections. And forms of tuberculosis: primary TB, latent TB, reactivation TB, miliary TB, pulmonary TB, lymph node TB, pericardial TB, CNS TB, gastrointestinal TB. So today we are going to talk about pulmonary tuberculosis in adults. It can arise in three forms. First one is progression of a primary lung infection. It means in a person who has never been infected tuberculosis before. This is a common way of infect TB in young adults. And the second form is progression of lung lesion from blood spread of bacilli after a primary lesion. This is not a very common type. The third form is reactivation of earlier primary lesion. This is common in middle-aged adults. And here you can see the primary lesion in adult, mostly in upper part of the lung, because oxygen level is higher in the upper part, so it helps to tuberculosis. And the next step is the enlargement of the lung lesion. You can see the lesion is enlarged. Then cassation means tissue necrosis. This results in a cavity spreads to opposite lung too. And in cassation, there is a liquid material in cavity. When you cough, that liquid come out and leave an air containing cavity. Tuberculosis multiply in that cavity and may break down into further cavities. Then fibrosis. After a year or two, fibrosis occurs. It pulls hilum and trachea up. Lesions may heal by fibrosis or scar tissues, and some lesions may calcify. We can diagnose the calcification by white material on X-ray. Calcification starts in all the lesions of lung apex. As the cavities are still opened, it is a major source of infection. Okay, now about the symptoms. Cough and sputum, blood spitting, chest pain, fever are the most common symptoms, and also weight loss, breathlessness, frequent cold, wheeze, and loss of appetite also are the symptoms of tuberculosis. There are many differential diagnoses for those symptoms, so we have to do a sputum test for tuberculosis. Then about investigations. Smear of sputum examined by Ziehl-Neelsen staining or fluoroscopy with UV light, and culture of sputum, drug resistant test, laryngeal swabs, and also we can investigate tuberculosis by gastric suction, bronchoscopy, pleural fluid, pleural biopsy, lung biopsy, and X-ray examination. In X-ray examination, as you see here, there will be patchy or nodular shadows in upper part of the lung, and we can diagnose cavitation by ring-shaped shadows and the horizontal fluid level on this shadow. And in this X-ray you can find it, the cavity formation, then calcified shadow, oval or round solitary shadows, highland mediastinal shadows because of the enlargement of the lymph nodes, and diffuse small nodular shadows. Here in this X-ray it shows the miliary TB, and we can see diffuse small nodular shadows here. And there are some differential diagnoses for tuberculosis like pneumonia, lung cancer, lung abscess, bronchiectasis, asthma. And now we are going to talk about the complications. Pleurisy, emphysema, spontaneous pneumothorax, tuberculous laryngitis, cor pulmonale, aspergillomata. Those are the complications of pulmonary TB. And now about treatments. For first line drugs, we can use rifampicin and isoniazid, and the second line antituberculosis drugs, we can use cycloserine, levofloxacin, streptomycin, ethionamide, amikacin, and kanamycin.